So on this week's episode we interviewed a guy by the name of Dr Simon Ruffell. Simon is a doctor who's been out in the Amazon researching the powerful effects of ayahuasca and the potential clinical benefits of ayahuasca. I suppose for us this marks the end of a series of different episodes where we've looked at plant medicines and the potential uses and benefits they have for your well-being. It's been really interesting. I would say from my perspective I've thoroughly enjoyed hearing all the stories, and I think that there's definitely been a lot of food for thought that's come from it.
Yeah, and we're really excited to speak to Dr Ruffell. This is a psychiatrist based in London and who's basically one of the UK's foremost experts on this plant medicine, so it's really great for us to be able to speak to an expert like him and bring his wealth of knowledge to the channel. So we hope you enjoy this interview as much as we did speaking to Simon.
Hi Simon, how you doing?
Hey guys, yeah, not too bad.
Good. Listen, want to say thanks first and foremost for inviting us down and having the opportunity to talk to you about the research you've been doing and hear more about your journey too. For us, it'd be great just to hear a little bit more about your background, you know, who you are, how you've got to where you've got to, and obviously we can then delve into some of the research you've been doing into ayahuasca.
Sure. Cool, sounds good. So my name is Simon Ruffell and I'm a psychiatric doctor based at South London and the Malton, which is an NHS hospital. But I also do research in psychedelics based at King's College London. But my research is primarily focused on ayahuasca, and that's actually more independent research, but we collaborate with a lot of different universities, including universities in the UK and also in South America and Brazil as well. We started doing the research about 5 years ago, investigating ayahuasca in retreat centres. So that's kind of traditional, adapted traditional settings in the Amazon rainforest. When we started doing the research, I actually ended up at a retreat centre called the Ayahuasca Foundation as a participant. I've been taking a bit of a break from medicine and ended up travelling around. And when I got there, I was pretty blown away with some of the results that we were seeing in the retreat centre. And so when I came back to the UK afterwards, I started looking more into psychedelic research, and was really surprised to see that no one really had looked into ayahuasca in retreat centre settings. There is research that looks into ayahuasca, primarily based in South America and Spain, but no one really looking at these retreat centres. And I thought that was quite bizarre, because whether you like it or not, whether you agree with the way that retreat centres works, more and more people are going to retreat centres and they're using ayahuasca. And so I think it's really important that we have data on that to see what's happening. And so we started investigating the use of ayahuasca in these retreat centres. The first study that we did was actually self-funded, because unsurprisingly nobody wanted to fund me and actually my best friend go into the jungle to research the use of ayahuasca. And so when we did that pilot study, we got some nice results. We published it in a pretty good journal. And then after that, I'm pleased to say that through I think of it as luck, maybe it's something else. We managed to get some money from the Medical Research Council, which was quite unexpected, and that was thanks to a professor called Celia Morgan at the University of Exeter, and that allowed us to keep conducting research looking at ayahuasca in these retreat settings.
You've touched on obviously the legal status of ayahuasca, and I'm really intrigued to understand what's changed. You know, here in the UK, obviously ayahuasca is illegal, but obviously not in the jungle in South America. What's changed to allow
a health board like NHS England to begin to invest in research into psychedelics, but also ayahuasca?
So the majority of the research that's going on into psychedelics at the moment is into psilocybin. The funding that we got is from the Medical Research Council, but that's almost a bit of an anomaly, I think. But you're right, there is a change in direction, or maybe a kind of a change in the acceptance of research into psychedelics. So when you say what's changed, I think there's probably a few things going on. I think that research in psychedelics in the 1950s was beginning to show promise, but due to some pretty questionable political reasons, that research was called off. I think also research into different successful ways of treating mental health problems has begun to stagnate over the last 20 years, and that's not just an opinion. There is less research into psychiatric medications, and there are less new treatments coming out. And I think when you look at other medical specialties over the last 20 years, they've progressed loads, and psychiatry hasn't so much. And so I think that this is another reason why people have begun to reopen those doors, looking at psychedelics, to look for new ways, or potentially old ways, of treating mental health problems. I think the political climate is beginning to change as well. When we look at things like MDMA, MDMA has been used to treat, or has been researched to see if it can help treat people with PTSD in the United States. And there seems to be a slight change in the political climate there as well. And we're seeing this shift with other substances that were previously illegal. So, for example, cannabis, that's the obvious one. People are being much more open to the potential therapeutic benefits of plant medicines.
Wow.
There's been a big shift when it comes to psilocybin mushrooms in America as well. Do you think this is a good sign of things to come possibly in the future?
I think so. I think that if the US are decriminalising plant medicines, and they have done in a few places like Oakland and Colorado and Denver, then that's suggestive that perhaps that will happen in the UK in the future. But I guess time will tell. What is really really exciting, and what's really what gives me a lot of hope, is the research that we're doing into psilocybin in the UK and also in the States. And recently this was fast tracked, so it was seen to be really important research. Research into potential medications normally takes 10 years or so before it gets a medication to actually be on the market. And when it's fast tracked, it means that happens a lot quicker, because it's seen to be important enough that people need it quicker than in 10 years' time.
Going into the ayahuasca experience, we've spoken to individuals who've participated in ceremonies and heard about the powerful transformative effects. We've also we've explored the support that participants get in retreat environments through a recent documentary we made. What's happening, like scientifically, if it's possible to explain, like what's happening in the body and the mind? What are the mechanisms that are allowing these transformative experiences to happen?
Sure. I mean that's an incredibly complex question, and I think a lot of it comes down to the paradigm that you follow as well. So from a Western scientific paradigm, ayahuasca is a brew of different plants. And there's the ayahuasca vine, and then there's leaves that contain DMT, normally chacruna, but it doesn't have to be. And that's the kind of the basic components in the ayahuasca brew. So DMT is a psychedelic compound, very, very similar to serotonin, which is in our brain. And it actually acts on the same receptors. So it acts on these serotonin 5-HT2A receptors. And that, loosely you could say, helps to regulate mood, helps to control your mood. The ayahuasca vine contains something called monoamine oxidase inhibitors. And this is actually an old form of antidepressants that are sometimes used in psychiatry as well. When you combine these together, the monoamine oxidase inhibitors in the vine prevent the breakdown of DMT, which is normally broken down in the stomach when you ingest it, and that allows the DMT to flow into your blood system and then have an impact on these receptors, and it causes the psychedelic effects and potentially some of the mood effects that we see as well. That's one way of describing how ayahuasca works. That's kind of the kind of what we understand as being the Western scientific way. I think if you speak to the curanderos in the Amazon, I don't think they would necessarily disagree with that explanation, but they might say that that is maybe a way that ayahuasca can work. But I think, well, the conversations that I've had, they would say you're kind of missing the point. You're missing the full flavour.
Simon and his colleagues Nige Netzband and Waifung Tsang have worked in partnership with the Ayahuasca Foundation in Peru, which is spearheading some of the world's most in-depth research on this traditional plant medicine. Studies are carried out at the Yourevolution Research Centre in the heart of the Amazon jungle, which was set up by American man Carlos Tanner in 2009, following his own life-changing experiences with ayahuasca a few years earlier. The Yourevolution Research Centre also appeared on Netflix recently as Zac Efron did some filming there for his series Down to Earth. Simon and his fellow scientists observed huge changes in ayahuasca drinkers at the centre and interviewed willing participants before their ayahuasca ceremonies, then afterwards and again 6 months later. Here's what they discovered.
Our first study was looking at the effects of ayahuasca on personality, and this was loosely based on a study that was done at Johns Hopkins looking at psilocybin's effect on personality. And so we're looking at personality in 5 different domains: how open, how conscientious, how agreeable, how extroverted, and how neurotic participants were before and after an ayahuasca retreat. And we also checked that 6 months later to see if there are any long-term changes. And what we found was that participants after drinking ayahuasca became statistically significantly less neurotic in the short term, and that was maintained 6 months later. And we also found that participants became slightly more agreeable after the 2 weeks, and then that was also maintained 6 months later as well. Yeah, so that was the first study, and we have quite a few other studies going on, but I'll just tell you about our most recent one as well. So our most recent one, we were looking at mental health outcomes related to childhood trauma. So we assessed the degree of childhood trauma that individuals had undergone, and then also looked at mental health measures such as depression, anxiety, and then other things like self-compassion and mindfulness. And we were seeing whether or not ayahuasca also had an impact on memory recall, seeing whether or not memories were more or less specific, and whether they were perceived as being more positive or more negative. So we found statistically significant decreases in depression and anxiety, and again that was maintained 6 months after the retreats, so that's quite exciting. And we also found improvements in things like self-compassion and mindfulness. In relation to memory, we found that participants perceived things that had happened in their life in a more positive way when they were looking back. So when we do our research, we always do semi-structured interviews with all of the participants as well, and then we analyse that and we publish that in separate journal articles, and that gives a more holistic idea of what's been happening with the participants. And so again, I think you can explain what's happened, or you can try to explain what's happened in different ways. So like we spoke about before, the improvements in depression could be put down to changing levels of serotonin in the brain, or DMT binding to certain receptors in the brain, and that causing changes in depression. Although the results were maintained 6 months later, when the vast majority of the participants weren't drinking any more ayahuasca. So that's something to bear in mind. So it could be, in a similar way that antidepressants work, it could be that ayahuasca is having an effect on these receptors. But I think it's much more than that. I don't think it's just chemicals and receptors. And I don't think that very many people who have drunk ayahuasca would say that either. In the semi-structured interviews that we did, participants quite often described going back to particularly poignant moments in their lives. This is a common thing that we saw. And that could be visually, or it could just be with their thoughts. And less frequently, it could be kind of hearing these things. But quite often they would go back to these moments, and they would get a different perspective on it. They would think about it differently, and they would almost begin to tackle the thing that had been giving them grief, almost like kind of trying to access that venom and remove that venom. And what we found is that participants on the whole, that the events in their lives that are causing them grief don't go away, but the way that you perceive it and the way that you relate to it can change. And that's what I think is causing or helping to one way of explaining how ayahuasca is working. So an example might be if you were abused as a child, and then you'd blamed yourself for that abuse, or you had a lot of hatred towards your abuser, and then through drinking ayahuasca you were able to confront that, and to see that from a different point of view. So for example, that it wasn't your fault that you were abused, that you could potentially forgive the abuser, that you could see it in a different angle, that the person who did that unforgivable thing for you was actually extremely unwell and it wasn't your fault. And I think that is an explanation that resonates with me, and that's something that we saw with the semi-structured interviews that we were doing. And then there's a whole other way of explaining what's happening, which is the more spiritual way of describing it, which is the way that the curanderos would describe what's happening. And a lot of that has to do with energy and spirituality, which is something that I'm thoroughly enjoying learning about, but I'm no means an expert in, so I'll leave it there for that.
As ayahuasca feels like it's exploding all over the world right now. Obviously there are retreats happening not just in the Amazon, but retreats happening all over Europe and in other parts of the world. Is ayahuasca the magic bullet to solving or helping solve some of the ills that we have as a civilization, as a species?
There's a really nice quote from an ayahuasca researcher who's really great, called Bia Lapache, who says, specifically in answer to that question, ayahuasca is not a magic bullet, but it's far more than an antidepressant. And I fully believe that. I don't think that there is a magic bullet. There's not one thing that's going to fix you, and there's not one thing that's going to fix the world. But ayahuasca couldn't be more different to an antidepressant tablet that you take. I think one of the first things to say is that it's not for everyone, and there are some people I think that don't benefit necessarily from ayahuasca in a more of a kind of a neutral way, and there are some people who probably should not be taking that because it could really do some damage. And here we're talking about things like people, well, from my opinion, people suffering from psychosis and some personality disorders. But again, I should say that sometimes the shamans have different points of view as to who they treat, so it would be up to them. But from my experience with the research, we normally see different people, or different reasons. It's actually quite similar people who go on these retreats, but different reasons for why they're on the retreats. There are people who don't want to take, for whatever reason, or don't want to engage with Western medicine, and they want to try something else, which is completely up to them. And then there are other people who have tried Western medicine and haven't found that it's helped. And we see that a lot of people with things like treatment-resistant depression, which is when you've tried 2 medications and they haven't worked for a long period of time. And those people begin searching for other things. And then we also see people who aren't necessarily trying to fix anything or trying to get help with anything, but they're interested in exploring either altered states of consciousness or potentially to get answers to some of the bigger questions that they have in their lives.
Interested to hear about what you were telling us earlier to do with PTSD and your interest in that area and possible positive outcomes ayahuasca could have with PTSD. Could you tell us more about that?
Sure. So this is it's a bit of a untapped, controversial area, I guess, looking at ayahuasca with PTSD, because it's perceived to be, and it's not even perceived, it can be quite risky, because if you're using ayahuasca to treat people with PTSD, there's a risk of re-traumatization. So you bring up all of these horrendous things that have happened and people relive them. That being said, there's a growing body of anecdotal evidence suggesting that ayahuasca can be very beneficial for people with PTSD. And there's actually a charity called Heroic Hearts, which is based in the UK and also in the United States. And so there are 2 branches. And they fundraise to send veterans to retreat centres to use primarily ayahuasca, but sometimes other plant medicines. So moving forward, what we would like to do is to start to do research into that area. So looking at some veterans drinking ayahuasca for PTSD. But it's definitely, ayahuasca is not to be taken lightly for anyone, but let alone if you have a condition, or you're suffering from a condition like PTSD.
You're out there doing research, which is, I think, slowly coming in from the wilderness. I'm just interested to know what does your scientific colleagues think of some of the work you're doing? Has it been well received? Have you had a lot of challenge?
Sure. I mean, that's an interesting question as well. So I'm very fortunate that I'm based at the Maudsley and King's in South London, and I'm part of the Psychedelic Trials group. So that research is, it's regarded as being, by many as being cutting edge research, and so it's really great to be a part of that group. But not all institutions are as open-minded and are as on the forefront when it comes to this kind of work. And so there definitely has been a couple of raised eyebrows, I guess, but that's normally from, I don't know how to say this politely. There will be more skeptical, old school generation of scientists. But I think that is also has its place and is important, because there's this other side of psychedelic research, and especially with ayahuasca, where it becomes sensationalized, and everyone thinks like, this is it, we don't need to do any research apart from this, just give everyone ayahuasca all the time. And it's like, well, that's like even worse. Like, definitely do not do that. So I think the skeptic, I get wholeheartedly open that skepticism, and it makes sure that we keep our research kind of top notch and kind of cutting edge, so there's people are in general coming around to it. I mean, there are psychedelic research departments at Imperial and King's now, and so it's no longer kind of fringe in those institutions, which is a really good sign.
Our channel is all about health, well-being, self-growth. I'm going to ask you the question just for your opinion. We don't personally advocate for anybody to do psychedelics or ayahuasca. We are simply, you know, I suppose shining a light on, you know, what's happening in this space. But when it comes to those, you know, three categories, do you think that ayahuasca and psychedelics more broadly can contribute to a greater sense of well-being, health and self-growth for anyone out there?
Yeah, I mean, I think you've hit the nail on the head there, where I don't think it's just kind of covering our own backs not to advocate for this kind of stuff, but I also think it's important not to advocate for it because, like we said before, some people like really struggle when taking psychedelics. That being said, if we look at the research that's coming out with psychedelics, not just mine, but with, you know, this huge body of research, and there's some, you know, really impressive randomized controlled trials, which are the gold standards of kind of lab-based research. It's more than suggesting that psychedelics for some people can play a very important role in everything that you just mentioned. But I also think it's important that people, if they do want to engage in that, do so, if possibly, well, legally, but also in a responsible way with people who know what they're doing, who have received training, and that may well be applying to be on psychedelic trials as a patient, you know, as a participant. That's a really good way of getting this experience. So that's what I would recommend if people wanted to engage at the moment.
Fab.
I wonder, you know, like, I wonder if this will be incorporated into mainstream psychiatry. I hope so. I think it will. I wonder if it will become slightly more like acupuncture, for example, where you have separate clinics that aren't really part of the mainstream NHS treatments, but they're there and they have their own regulatory body, and you can go to those independently. I'd be interested to see how ayahuasca is incorporated more into Western treatment cultures, and to see whether or not there are separate clinics, like we're beginning to see around the world, that use plant medicines. And I wonder how much of that will be incorporated into mainstream, like the NHS.